Hi, I'm Dr. William Duran, orthopedic surgeon at TidalHealth, and I need to tell you it's showtime.
This segment of Delmarva Life is brought to you by TidalHealth.
You know, I probably don't have to tell you, technology has really come a long ways over the years. Did you ever think that you would see the day when communicating via a screen would be the only way you could keep in touch with friends and family in the middle of a global pandemic? I didn't. How about we step that up a notch and talk about robots helping with surgery? It is a thing, and it is happening right here on Delmarva. I've got someone I'd like to introduce you to. This is Dr. William Duran. Dr. Duran's an orthopedic doctor at TidalHealth. Thank you so much for talking to us today.
It's my pleasure.
Now, make sure that I get all this right. Correct me if I'm wrong. TidalHealth, first on Delmarva, offering robotic arm-assisted knee replacement surgery. Tell me how this technology works.
In a simple way, what we do is we get a CAT scan of the length of your femur and your tibia. And with that information, the computer is able to know the three-dimensional structure of your knee during surgery. We put in some information, and with that bit of information, we're able to use the Mako robot, which is seated over my shoulder here. Oh, the other side. It's complicated. I need more technology assistance here. No, we're able to use that information, and we can give an incredibly precise implant for an individual that gives them a better chance of a long-term and excellent outcome.
Okay, so you're proud to offer patient-centered care. How does Mako help you tailor the procedure to the patient's specific needs?
Okay, so with the Mako robot, as I was saying, we get this CAT scan. So the CAT scan is an individual person's bone structure. When we're in surgery, I paint the end of the femur, which is the thigh bone, and the top of the shin bone, which is the tibia. And once we give the computer that information, the computer has, as I was saying, a three-dimensional structure of your knee, which when the surgery is occurring, at the end of surgery, we know that we have an implant that is going to be, pardon me there, about it's this thick going in, okay?
Okay.
And we know that we want to cut out bone to fit in an implant that is this thick. And if you cut out what you put back in, it'll be perfectly balanced. And that's what allows for a person to have a very well-fit structure for themselves.
When it gets down to this, does this help with pain, less pain? Does it help with recovery?
So one of the beauties of knowing exactly where those implants are going, and particularly where the saw blade will be, as the Mako has an electronic protection from going too deep, is you don't have to take as big of a dissection, and by not taking as big of a dissection, you should be able to see a quicker recovery.
So the easiest part here for the patient is to leave it in your capable hands. How long did it take you to master the skills on this robotic arm?
You have multiple trainings before you ever get a chance to work on a person, and I've been doing it now since November of 2018, and I've done many hundred. So I think I'm doing pretty good at this point in time.
It certainly sounds like it. If I'm thinking maybe I'm a candidate for joint replacement, for knee joint replacement, what do I need to do?
If we can treat your pain conservatively without surgery with injections or pain meds, we always try to utilize that first. But if we reach a point where conservative therapies, injections, and anti-inflammatory medications are no longer providing the relief that you're looking for, at that point in time, we have discussions about surgical intervention. And basically it just requires making a phone call. I have an opportunity to look at your x-rays and tailor a program that will work for each individual person.
Dr. William Duran with TidalHealth, orthopedic doctor there. Thank you so much for talking to us this afternoon.
It's been my pleasure.